Hey, good morning. Mary is not in, so I want to make sure she gets in. You're on mute. Sarah, you're on mute. There you are.
There we go. My headphones finally.
At sbcglobal.com. Okay, let's see if that works. I swear to God, I try to turn off these darn notifications. It just doesn't work. Okay, so you're going to be my time checker this morning, right?
Yeah.
Okay. Oh, why is Zoom giving me a hard time this morning? Come on, Zoom.
I don't know.
Okay. I thought I already sent her the invite. In fact,
Yeah.
I don't know why she doesn't have it. Okay, I'm going to share my screen with the deck, which I just downloaded.
Perfect.
That must be Mary. Hold on, I don't want to record this part. So,
And I wasn't sure where we wanted the screen with the COVID-19.
Hold on one second. For some reason, it's recording and I don't know how to turn that off. There we go. So just let's go ahead and get started. So today, what do we want to do for our reopening workshops? First and foremost, we want to understand some of the basics. I know we're all reading a lot about this, but I think it's important to understand the basics so that you can actually come up with the right strategies to modify your operations to keep our customers and your employees safe in the situation that we're dealing with as we go to reopen. The other thing is we want to make sure we have plans in place. The state has asked for us to have plans when we go to reopen, and we've put together a worksheet that can, quite frankly, serve as that plan for you. And then the last thing is really talk about how do we manage the situation with employees, with customers, because let's face it, there could be some stickiness, and we know that there could be some situations. So we want to talk about that. Couple rules. If you've got questions while Mary is presenting up front, just use the chat function so that we can actually get those questions answered. We're not opposed to having some dialogue through the front part of the presentation, but we do want to try to keep this to our hour time frame so that everybody can get back to what they're doing. Also, if you could mute your Zoom while you're not speaking, we are going to have some dialogue, so just figure out where your mute button is. I think it's important. Yeah, good job, Adrian. Thank you. So that's sort of our objectives and our ground rules for this morning. So I think the first thing we want to do is we want to just hear who's on the phone, say good morning, and if you could just your name, your business, I would call this rapid fire sort of introduction, and then maybe what your number one concern is. Let me start off with Adrian. Would you be just introduce yourself real quick and just tell us who your business is and what your number one concern is around reopening or continuing to operate? It's not letting you. Oh, there you go. Let me just unmute you. I got. Okay. Okay. It's not. There you go.
Okay. I guess you had the con. I teach music and French from my home as a private teacher, and so I didn't know which category to actually join. Okay. So I guess it's a non-essential. But you know, I have kids coming and going and parents waiting for them. And so that's, right now I'm exclusively online and I'm actually trying to decide whether to just keep it that way.
Yeah, good. Kathy, how about you?
Good morning, everybody. My name is Kathy Rains and my daughter Whitney Rose and I own Gather. And I think our primary concern is just trying to figure out how to keep everybody safe, both customers and staff. So we're making some changes to our schedule. We're going to add some personal shopping in the mornings and late in the afternoon, and so people can make appointments to come in. And then we're also going to be closed on Tuesdays and Wednesdays going forward until things kind of get back to whatever the new normal is going to be. So
yeah, well, let's hope we get there, right, Kathy?
I know, exactly.
Keep fingers crossed. Kay,
Yep.
how about you? I see you there, Kay. Up, let me unmute. There you go. Now I can hear you.
Okay.
Unmute us.
My name is Kay Longy. I sit on the board of the Friends of Mukai. Our grounds have been open, of course, during this entire event, but at some point we will be opening the house for interested people to come and just tour the house and learn about the Mukais and their story. But we also want to use the house as a rental facility for dinners and meetings and events. And that's where I think most of my concern lies, is making sure that we understand what the latest is in terms of the number of people that are allowed in such and such a space, and how we keep them clean, and just do our part for the community in general.
That's wonderful. Thank you, Kay. And by the way, thank you for holding the testing there. That was very good. Thank you.
Yeah, we were honored to do that on the behalf of the community. It was such an ideal location for it.
Yeah.
That we just had to do it.
Yep. Thank you. Judith, how about you?
My name's Judith Neary, and I have the small design studio across from Green Ginger, which is actually now Yellow Ginger, if you think about it. My challenge is managing walk-in traffic appointments with a very, very small design studio of 300 square feet, and not alienating anyone, which I think is everyone's challenge. So I really thank you all for the dialogue, because I've gotten some great ideas and how to manage this. So thank you very much.
Thanks for joining. Bernie, how are you? Good morning.
Good morning. For some reason, I can only get 6 pictures. Am I doing this wrong, or is that just how it works?
There's people who aren't showing their videos, so
All
it's
right.
okay.
So I'm from Mally. For 16 years, I had a fruit stand on the corner. I moved now to a different corner. My major concern is that none of the merchants will be there. So first of all, I'll stick out like a sore thumb, and I'm not used to being a lonesome cowboy. And secondly, I'm not sure the traffic will be there, so it's hard for me to figure out how to open.
Okay.
Is how to say no to people who are not going to wear a mask.
Oh, yeah.
I'm in a place now where a lot of the old white guys, I happen to be one of them, won't wear a mask because they're not afraid to die. But of course, that's not the question. Is the question.
Yeah.
So those are my major concerns. Is I don't want to be lonesome out there. I want to know when the merchants are going to show up, like Giraffe, my next door neighbor.
Yep.
Matt's going to show up, sort of, but the grab and go doesn't work for me. So
Yep.
that's my
Yep. Thank you so much, Bernie. And Michael, how about you?
Yes, I'm Mike Duvier, the owner of Doug's Auto Repair, and we're going to be reopening on June 1st. And I just want to check in to see if there's anything I've forgotten to do for the safety of the customers and my workers.
Great. Thank you. Elsa?
Hi, I'm Elsa Grunquist. I'm with the Heritage Museum. And our concerns are, of course, opening to the public and keeping our docents safe and the public safe.
Yeah.
And I've been to a lot of seminars around this. And so this is ideal to come right now for us to put a plan together. How do we let people in and, keep, as Kay said, keep things clean, wipe things down. Anyway, we can go into all of that, but
Yep,
people safe.
absolutely.
Mhm.
And Sarah, just can you introduce yourself real quick?
Yeah, I'm Sarah Deal. I am typically the master's rowing coach for Vashon, but I have been brought on to do some coordinating for the Chamber of Commerce around these workshops, and the kits will be distributing afterwards.
Great. And I saw Sean also joined. Sean, do you just want to say good morning and just tell everybody who you are?
Can everybody
And
hear
what
me? I don't
you've
know if
been
my
up to?
mic's on.
You are on.
Oh, hi. My name's Sean. I just like tuning in. I'm very interested in the island and island businesses. So I just like tuning in, hearing what people are talking about, and just basically a fly on the wall.
Okay, great, Sean. Nice to have you. And then I'm going to actually have Mary introduce herself, our facilitator workshop. Mary.
Well, for those of you I know, hi. For those who I don't, I hope to meet you soon. I'm Mary Bergman. I live on the island. I'm a retired pediatrician and with a subspecialty in immunology and rheumatology. I practiced in Dallas, Texas at Baylor. I've been involved in a couple epidemics in the past. We've had 2 measles outbreaks in Dallas that I led. The fight against the spread, and also unfortunately got involved with the Ebola crisis we had in Dallas more recently. I'm not an expert on COVID-19, and I'm not an expert on how to reopen businesses that have been stay at home of a pandemic. My first thing to state about that, if anybody says they are an expert on those 2 topics, I kind of question it. This is all brand new. We haven't been here before, and we're all learning as we go. To that extent, I reviewed all the, I don't know if you can see them, the P2 or phase 1 job requirements for COVID-19 that have been put out by the state and King County. And also I have done a deep dive into every bit of data and information I can get to give you the most accurate and knowledge-driven information about COVID-19. The biggest thing I've learned reading through all of the job site requirements and what they want either an artist to do versus a restaurant to do is they all deal with the basic same ideas. And so we're going to go over those ideas. And then how do you really fine tune it to your specific need, because that's the key. You know your site, you know your employees and that, and how can we help you kind of walk through it to see what are you going to need to do to keep everybody safe. So with that, are we ready to go? Next slide. And it's still, oh, there we go. Okay. COVID-19, it's a respiratory virus. I think we know that, but I think if we keep that in mind at all times, it's a respiratory virus. That's how it's going to spread. That's how we're going to try to contain it. It is a SARS, a severe acute respiratory syndrome virus. We've got a couple of those we've had in my lifetime, so we are aware of what SARS can do. It's in fact the true name of it is called SARS-CoV-2. When it first came out, COVID-19 was the name of the disease. SARS-CoV-2 is the name of the virus, but now I think we use them interchangeably. The picture of the slide on the bottom is just a fun fact for you all. If you look at the spike protein, that's what everybody's going after, it appears to, for the vaccine and the immunology. It's that little kind of tooty horn thing that they're going after. So with that, remember the biggest thing here, it's a respiratory virus. Next. Okay, COVID-19, fun fact number 2. How do we get the name? It's very easy. Corona, it's a coronavirus. It's VI stands for virus, D is disease, and it just came out in winter of 2019. That tells us why we don't know much about it. So COVID-19 is just a word we created using other words to describe it. Next slide. Okay, it's a new and improved. We've never seen it before. We've never had it before. It's a brand new disease. It's 2019 it came out. That's not a good thing. That's a horrible thing when we talk about viruses, because that means nobody has ever had any immunity to it. Rare do we have these situations. You know, we've had outbreaks of measles, we've had outbreaks of this or that, but you know, we've had HIV come out. That was one that was a new one. Ebola was a new one. Well, now this is one of our new ones. I went to medical school residency and I did my fellowship alongside Brett Gerard, who's now working with our president, and he was working on the vaccine. And he was yelling at this early on when I was in med school that this was going to be our downfall. New viruses, new bacteria, whether they were man-made or whether they were made in our environment, this is what can bring us down. So he was aware of it for a long time. It's so we don't have good information about it and nobody's got immunity about it. With knowing that, you're going to hear things change as we go through. And the more data we get, the fine tuner we can make our recommendations. So expect change. We always knew it was a respiratory virus. So we always knew it was a coronavirus. So we knew that part. Now we have 5 months experience. We have some data from those 5 months. We also know it's a SARS. We've had previous SARS experience. So we've been able to pull that in our data. So it gives us, how should I say, big grouping of data. But once we get more specific COVID-19 data, we'll be able to fine tune it even better. Next slide. Hi, Cheryl. Next slide. Okay, good. With saying that, if you haven't seen this, King County came out with this yesterday. I think it's a great slide. Oh, by the way, I love data. So just know if I say it's a great slide, it's coming from somebody who loves data. You probably all heard it, that we probably will not be going into phase 2 on June 1. But this is a new slide indicator that the governor put out and is now on the King County page, and it shows us how close we are. It is really close to getting where we can reopen. And the keynotes are the number per 100,000. We need to get down just a little more. We need to get below that red line. And then we also have to get our testing capacity up. Everything else we've passed. So that's kind of good to know where we are, what we've passed, and what we need to do. So now's the time we need to hunker down even tighter to get those positive patients down. Next slide. Okay, symptoms of COVID-19. I'm also going to tell you these are symptoms of every bad respiratory virus. It's not specific to COVID-19 except for the last one. Fever, cough, shortness of breath, chills and muscle pain, fatigue. The one that seems more specific to COVID-19 are the new loss of taste and smell. And that's a pretty key one. If we can find something that's unique to COVID-19, that's really going to help us nail this and be able to quarantine people better and get it down better. Here's the bad news I have to tell you about. COVID-19 is a respiratory illness. When you acquire it, when you're infected with it, you have to grow the virus in your body. You have to incubate it, and it has to come to a certain level, and at that point in time you start having symptoms. Unfortunately, you need a pretty high load, a viral load, to have symptoms, but you can start spreading it way before you have symptoms. This is one of the problems with COVID-19. You can have people who say, I feel fine, I look fine, I am fine, and they can be incubating that virus, and every time they breathe, spread it around. So the key points on this slide are, yes, those are those symptoms, and yeah, they're probably similar symptoms to all the other respiratory viruses, but you have to know you don't need symptoms to be a carrier of this virus and spread it around. And that's the key. We've got to really assume everybody can spread this virus around, so we're going to keep people safe from getting it if you have it. Next slide. Another fun slide. Again, more data. These are all respiratory illnesses. The flu, COVID-19, SARS, and MRSA, they're all respiratory illnesses. Some are influenza, some are the SARS, and some are coronaviruses. They all have similar symptoms. What they're different on, they all have unique differences. The two key parts I want to bring up, because I know I'm hearing it, so I think a lot of other people are hearing it, that COVID-19 is just like the flu. It's just like the flu, so what are we worried about? Well, it has a lot of similarities of the flu. That's true. It's a respiratory virus, but it has a lot of differences. And the two big ones are, the first, if you can look at the R0, or it's on your left-hand side, it says basic reproductive number. It looks like an R0, it's called R0. The flu is a 1.3. That means on average, if you have 100 people with the virus spreading it, 130 people will get it. A little over 1 to 1. COVID-19, nope, you're 2 to 2.5. They'll probably tighten that up. Those asterisks, because I think all those numbers are going to get tightened up as we get more data. So it's more infectious. COVID-19 is more infectious than the flu. Next line, case fatality, much more higher case fatality than influenza. However, it's less than SARS, the first SARS and MRSA, but it's higher than the flu. I think the key to why COVID-19 is a problem, and it's going to remain a problem until we have herd immunity or we have a vaccine, is the incubation time. The flu, when you get the flu, you're infected with it, you almost get the symptoms starting on day 1 or day 2. And when you get the symptoms, you are down for the count. You are at home, you have been hit by a Mack truck and you feel lousy. Once you get the symptoms, you're taken out of the pool of infecting more people. COVID-19 it's messy. You don't get all the symptoms. You can get fever. You might not get fever. You can get bad cough. You may just get sinus headaches. It doesn't have this well-defined illness. So, and there's a delay before you get these symptoms. So you are out and about spreading it before you even know you have it. The fact that we don't have a well-defined illness, you know, it can do many different things in many different people, and you have a long incubation phase, that increases its infectivity. It means we're going to keep spreading it around because we aren't staying home with it because we don't even know we have it. So COVID-19 and the flu are very similar, but they're not the same in all aspects. We can take heart that COVID-19 is better in some things. If you can look at it, look at MRSA. You have a 1 in 3 chance of dying with it. So, okay, it's not that bad. We're down to 3.4 chance of our death rate. And even then, you have to look at the age in that. So, but that's going off. So next slide. Okay, I keep stressing it's a respiratory illness, just like those last 4, respiratory. They all transmit the same way. The reason this is so important is this is how you're gonna keep down the spread. Droplets are the way respiratory illnesses spread. It's droplets from your respiratory area, and it's your upper respiratory tract, not your lower. It is your nose, your mouth. It's from coughing, sneezing, breathing, singing. That's how you get these droplets out. Initially, when we started talking about COVID, we were talking about sing the birthday song for washing your hands. Keep your hands away from your face. That was constant. That's what you heard. And then you heard gradually, we kind of moved on and we started talking about, okay, let's think about 6 foot distance. Let's think about face masks or cloth masks. Why did we change? It was the size of those droplets. Initially, I think we thought they were large size droplets that fell fast, and it was going to be direct contact to this, how you got it. You pick it up on your hand, you put your hand to your face, that's how you get it in. When we found out that they were more medium sized droplets, it meant that they stay in the air longer and you can breathe them in. That's why you saw us not leave the fact of wash your hands in that, but you saw people now talking about 6 foot distance, social distancing, and also wearing a face mask. So there's 2 ways to get a respiratory illness. You can even get the droplets through airborne, or you can get them through direct contact. Those are key things. Next. Okay, this is just a great thing to show you. If you're coughing, screaming, yelling, sneezing, it's pretty powerful and it goes all over the place. Next. This is just to show 200 miles an hour if you sneeze. 200 miles an hour, that is amazing. So it is so important. If people are sick, they need to be at home. They need to stay out of the population for their sake too, to get better faster, and also to keep from spreading it. A breath, you can spread, but it's much lower amount and not as far. This is important. You may be breathing it if you're asymptomatic, but if you have symptoms, let's keep them out of places of business, out of social contact and that. Let's keep them at home getting well. Next. Okay, so how do we decrease airborne? I keep bringing it up, I'll say it again. Next slide. Okay, if you have symptoms, if you know you're sick, you stay at home or you cover your cough and sneeze. I would suggest everybody, tissues all over your place of business and a trash can close. I have allergies. You don't want me near your place because my hands cannot keep from going to my nose and my face. I might sneeze from an allergy. Have these available because you don't know. I may have allergies and also be incubating the illness. So if you keep everybody who has symptoms away, then you're talking about how do you keep the asymptomatic people from spreading it. Face mask, yep, they work. They're keeping you from spreading it to other people. I think everybody's got that. It's just people don't realize that you can be a transmitter of this disease without even having symptoms. The next is social distancing. 6 feet is the key. The next two are, and I should say this up front, these are mine. These are, in reading everything, these are 2 new ones that I've put together. I think the data is supported. I'm hoping that other people will pick it up. But limit time and consider the airflow around you. And we're going to get more into that specifically. But I would say there's 4 ways for asymptomatic to decrease airborne transmission. Wear a mask, social distancing, limit the time you have interactions, and consider the airflow. Next slide. Okay, why do we say 6 feet? It depended on the size of the particle that COVID-19 was likes to grow in. And it's kind of in the medium size, which is really good. If it was an aerosol, it'd be horrible because that just stays in the air and doesn't even fall out. So if you look at just breathing, the exhalation, it's about 4.5 meters. That's why we're saying 6 feet. Okay, that is breathing without a face mask. Look at the coughs and sneeze, you're way past 6 feet. You cough or sneeze, use tissues, use something to block that because it's going to go all over the place. Okay, next slide. Okay, this is my time. Well, okay, we'll go back to face cloths and masks. Masks because if you have to do something closer than 6 feet, that's going to keep it from spreading if you're an asymptomatic person. That is, it is helpful, it is useful. I'm hoping that we will get used to seeing people in these because I think it can help. I do want you to look at the guy with what we call a sneeze shield. It's the glass shield above there. Think of that helping 2 ways. It helps if he is infectious and not spreading it, but it also helps if you have a worker that has allergies like myself or that, and I can't keep my hands away from my face. Put a shield on me. Every time I go to itch my eyes, I'm going to hit that shield and not touch my eyes. This is important. This is a good way to do it. So we're kind of cross things. I said we wear face masks for airborne, so we can't present it, but you can also use like a face shield to help with direct contact if you've got somebody who wants to keep itching their eyes.
Okay. And Mary, can I just add a quick point about the face shield and also the one that is like got the cutout with the clear plastic?
Yeah.
For people who have issues with hearing. And also if you're trying to talk while you're in business, it is very difficult to talk with the mask on and have people be able to hear you. And so I like the face shield and also the one with the cutout as an alternative, because it does actually allow for communication to be a little bit better. And, you know, all of us in business trying to share our story or talk about what we're doing, that is actually a really key consideration. Just wanted to mention that.
Very good, very good.
A little.
Okay, back to the time slide. Okay, time. This is my feeling on this. To acquire the illness, you need a specific viral load. That means that if the viral load is 10,000 and I only inhaled 1,000, my body can handle it and I'm not going to get the disease. That's important. But the viral exposure to virus can be accumulative. That means if I'm sitting there having coffee with my friend, she looks well, I'm well, nothing's going on. She's really incubating the virus, and every time she breathes, she's putting out 1,000 viral particles, and I'm breathing it in. If I was with her for a brief period of time and only took one breath, I'm fine. If I was with her for 20 breaths, I now have taken in 20,000 viral particles, and now I'm susceptible. So viral load, or a successful infection, it's not only just exposure to the virus, it's how many hits did you get from that exposure. And I think this is going to be really important, and you can use this in your practice, and you can stay there, Cheryl, because if you can decrease that time that somebody is in front of you, that's going to help. Bernie, you know, I'm a client of Bernie's, and by the way, we're waiting for you to open. So Bernie, if I came up to you and I said, "Ooh, what do you got today?" Huh, and you give it to me, and then I say, "Oh, I'll take some cherries, I'll take some blueberries," and we start having a conversation. That's much more of an exposure than if you had a sign out there showing me everything you had, and I came up and I said, "I want blueberry, this, this, and this," and we got it. You know, decreasing the time that your employees are exposed to people who may be infected, or vice versa, the customer may be exposed to the employee, may really help in decreasing the spread of this virus. So always think, it's viral load is dependent on time and how much virus is being excreted. This is some of the data is pretty clear on this, and this is just it's called a 4-square chart. The place you want to be is really in short time, low volume. So it's your lower left-hand corner. You want to be a supermarket, walking past a jogger, a brief encounter. You pass somebody in the street, you said hi, you waved, you were closer than 6 feet, you didn't have a mask, you probably are fine. That's where you want to live. If you're in right north of it, say the long time, low volume, that's another question. You don't want to be there either. This is people that don't have a lot of secretions, but you're with them for a long time. It's your churches, your workspace, your funeral, your weddings, your restaurants, your choir practices. This came out from, I'm sure you heard the story of a Washington choir practice that nobody was sick. They were doing 6-foot distancing. They were doing everything right. And a good percentage got an illness, and 2 people ended up dying. And this is because it was a 2.5-hour choir practice. And when you're in choir practice, you need to take a deep breath, and they were just sucking in an asymptomatic person's viral particles exposure. The worst place you want to be is to the right of that, and that's hospitals and household infections. That's because it's a high volume and a long time. So you're going to see them in much bigger protective gear. They're really covered up, and because they need to be exposed to it, but they need to be helping people at the same time. High volume, short time is more people taking the swabs from people's nose. They know people might be positive, a high volume of it. But if they can be in and out and not breathe while they're doing it, that's the best. My other key point is airflow. Consider airflow when you're talking about things. When we showed that one picture of the two people sitting there having coffee, they were right smack in front of each other. That's really where you do not want to be. If you can cock yourself so that, and as these two people are doing, so that your airflow is going right next to them and their airflow is going next to you, but you're still maintaining eye contact or that's best. It's a really simple thing to, instead of talking in front of somebody, but stepping to the side and kind of talking kitty corner to them, you're gonna now be spreading the possible spread of the virus away from their breath. And that's what you want to do. It's also why outside is so much better than inside, because you have airflow from air conditioners and that inside that can really make a difference. So parallel talking is better than face-to-face. It's even better if you're sitting looking at the water and you both are sitting there, both looking out and talking side by side. Side by side, parallel are much better than face-to-face. Next slide. This is, I have horrible internet speed at my house, so I'm probably delayed than most other people. This is where we really learned about the airflow being an issue, and it's a restaurant. And if you looked at the tables over there, you'll see one is a person who was sitting at the table. She was patient 0. She was the one who had the illness. Didn't have the symptoms of it. She was before her symptoms showed, but she was expelling the virus just in her breath and while she was eating. So of course she was not wearing a face mask. She was unmasked. If you look at who got the illness from her, everybody who is red there got the illness from her. And I don't know, Cheryl, if you can, in mine, I've got people over it, but those blue bars is the air conditioning airflow vent. It just took that virus. You can follow where the airflow was because everybody who was in that airflow from where the air conditioner was blowing got it. The people who weren't did not get it. So consider airflow, consider time you spend with people. Next. This is just quick and dirty. It's another study. I really researched everything to try to find examples for you. This is a workplace who one person on the top of the office got it. Look at, you can tell where the airflow was. The top part was airflow driven. The bottom ones they think were more in direct contact. These people in the lower part of it did not get it from the airflow. They got it from direct contact.
Yeah, and Mary, one of the questions that just came into the chat was, will air filters help?
You know, I'm going to tell you, they can't hurt, but they're not going to fix everything because a lot of it is just the flow of air past your mouth. And if it's going to the next person at the time, it's before it even gets to the air filters.
And actually, I think Kathy dropped out, but she's the one who asked the question. So you're saying they can help, but they can't fix the whole solution.
Right, correct, correct.
Direct transfer.
Okay. So that was the airborne. So remember, you get droplets. They either can cause problem because they've gone airborne and people breathe them in, or they fall to a surface and you pick them up and put them in the mouth. So how do we decrease direct transfer? Next. Okay, don't touch your face. We've heard that over and over again. I've said it over again. Do I still touch my face? Yep. So anything you can do to stop touching your face is good because I can pick up others people's germs and put it to my face, and that's how it gets in. It's going to get in through my nose, my eyes, my mouth, or I can take it, the viruses from my face and put it on surfaces and send it other places. So the other day I was cutting garlic, and I put my hand to my face and went, whoa, you know, I had garlic all over my hand. I could smell it. Boy, did that tell me how many times I kept touching my face. So, you know, another way I've learned, start playing with garlic, and then I'll know how better to keep my hands away from my face. Washing hands or sanitizer. Can we get a show of hands? Are these equal, or do you think one is better than the other? Let's just say soap and water washing is the same as sanitized hands. Who says yay on that? Okay, can you see everybody, show? Well,
Actually, I think the group knows it's not the same.
I was going to say, I just had a discussion. I think Sarah's had discussions about this too. People are trying to tell me that sanitizer is just as good as soap and water. Nope, 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 nope. Soap and water is the best. We know it over again, but you got to do it right. Make sure people know how to do it. You need to get between your fingers. You need to make sure to get your thumbs. You need to get your wrists. Those are the places. Everybody's seen, before we have to do a sterile procedure or we go into surgery, we're always scrubbing hands and we get everything. And then we put on sterile gloves. Okay, next slide. Okay, highly touchable surfaces need to be cleaned frequently. We know this, we really do. Doorknobs, phones, car handles, trash cans, all these. Try to get people not to touch so many surfaces and clean them as soon as we can. I'm gonna say though, I saw Kay was on here from Mukai. Think about all your surfaces. Walk your place like you were somebody coming for the first time. When you go to Mukai, you have to go up steps to go in the house. You're always going to be touching that handrail. Think about handrails. Think about walk your area like you were a client or a patron and see what you were touching. And that's what you're going to know of what you need to keep cleaning. And when I say keep cleaning it. Anytime you can is better. I could say every hour. I could say 30 minutes is better. But if it's a highly touchable surface, it's best to do it frequently. Next.
Yeah, on the credit card terminals, we're wiping those down after every use.
And I guess a lot of people have probably been through the ferry too. They've put them on those poles that you use for your photos, taking selfies, and they put the credit card thing. So the person does it, and that's it. You hold your card, you touch the card, and you don't have to touch the credit card thing. So you can get really creative. When you see that you have an issue at one spot, how am I going to fix it? That's when it's fun to get creative. Do we know how long the virus lasts on paper, plastic, and doorknobs? No, we don't. Data will come out. I'm sure it will come out, but we don't know. It's clear that it lasts on plastic longer than paper. Chrome versus plastic, we don't know. But one thing we do know is it has been transferred to people that way who have gotten sick. And we found this out through some of the house cleaners of hospitals and that, where they were never in contact with infected people and they were cleaners and they ended up getting the illness. So we know it can happen. We don't know how long. More time is better. This is where time is in our favor. If you get your mail, leave it sit for a day. If you have people trying on clothes, they're going to request that you take that piece of clothes out of circulation for 24 hours just to be on the safe side. But I think they're going to clean this up, and I think it's going to be a help. I think they're going to find that on clothes, it's not going to be a big deal. Paper, it's not going to be a big deal. Plastic, it may be.
And, I'm just sitting here thinking about Michael with the auto shop. I mean, would you recommend cleaning tools or something along those lines if multiple people are using them?
I would be concerned if people are using the same tool, construction sites, things like that. Try to have your own. If it is something that you can't, it's everybody's. In between, each time a person touches it, it should be cleaned.
Right.
Mary, you're also showing an apple. How many apples do I have to clean?
Keep the doctor way. Thank you, Bernie. Really, there's been no sign or evidence of transfer by taking something from that you've eaten.
But it's in your diagram.
Yeah, I know. And that is because it was in case I needed to talk about it, is if I'm going to Bernie's place, I am a toucher and a feeler, and he's going to say, Mary, stop doing that. If I pick up an apple and then I put it down, and then somebody else picks up the apple, then it's on their hand. So it's okay to eat it because the virus will not survive through your GI tract. It's not okay to touch it and then put your hand to your face. So for you, I would say, Bernie, when you see me coming, say, no, no, Mary, stop touching and smelling the fruit and vegetables. I would say no hands-on. Does that answer you?
Last thing again, Mary?
I would say keep your customers from touching their, until they buy, or they touch it, they bought it.
Right, that's on my sign, but, so just one more thing. You said if you swallow the virus, it's
inactivated. It doesn't survive the high acid in your stomach.
I don't think I heard that before. Thank you.
Okay.
Mary, another question that came up from Judith is on one of our meetings. I know that a bunch of the galleries in town are going to be using cloth gloves to for patrons so that if they want to touch something, and then they're to take them off before they leave. Do you think that helps?
I'm hesitant on that because I can tell you if I'm wearing a cloth glove, I can still touch my face. If I touch my face and touch another, a counter or a piece of art, then I've now just put it right on my face. My hand and my glove probably would be no different. However, you can use a glove very smartly. Use one glove so you have a dirty hand and a clean hand. So that gloved hand does not touch your phone. It does not touch your face. It does not touch anything except for what apparently you might need to be touching in a gallery and art. It's hard to do. You have to have somebody really watching the two hands if you want to have a clean hand and a dirty hand. We do this a lot in emergency settings and that, where if we have to get in there quick, we try to get one clean and we keep one dirty. We always have somebody who's a watcher of the physician saying, watch your hand, watch your hand. And that's kind of what you got to do. The best thing to do is get people as soon as they come in to clean their hands. If they want to touch something, clean your hands again. You know,
So sanitizer at the entrance, because you obviously aren't going to have a hand washing station for most businesses, but sanitizer at the entrance and then sanitizer as people leave.
So I think you can use those gloves. I applaud them. What a brilliant idea. It's just, think of it. Would you keep a really nicely gloved hand away from your face? Probably. I would, probably it's not going to be such a great deterrent. Okay.
Cheryl,
Go ahead, Kay.
I can't figure out how to send a message, so I'm sorry I'm interrupting.
No, that's totally all right. Ask your question, Kay. We're good.
Mary, so, we can have masks ready. For instance, when you walk into Thriftway, they'll give you a mask if you need one. But somebody's touched that mask to hand it to you. What is the protocol with a mask? Do we need to keep them sort of sterile in order to hand them to people?
Not really. You're going to be touching the outside of the mask. Their infectivity would be on the inside. So if I have my mask here and I'm handing it, I would probably try to hand it from either an elastic around it or from the outside of it. The inside of it, keep clean. So this
Maybe
is the part
fold
that,
it in half with the clean
Right.
sides together.
Yep, that would be good. That would be good.
That way.
Okay, thank you.
Okay.
Somebody tell me how to send a message.
You go to chat.
Yeah,
Yeah, and click on chat, and then you just click to talk to everybody. And while we're on masks, Mary, can you just tell us a little bit if you have a preferred type of mask? And just so everybody knows, the source for masks is going to be in your kit for attending this workshop. Just a side note, Judith, we're going to have masks for you that Vashon has made specifically for all of the business kits for people who come. So you'll have extras for your people. But Mary, do you have a preferred mask?
The most preferred mask is the one that fits your face the best. To be honest, you need something that's comfortable for you and that fits. So you want something that's pretty good over the bridge of the nose and is comfortable here. Anything that you can keep air from coming out the sides, and that is the best. The N95s, everybody knows, are really your best mask. If you have a high risk, if you get it and you're going to have problems with this illness, then I think that's something well worth getting. But let's be honest, the mask that works is the mask that you wear. And that's what I would tell people. If they're comfortable wearing a mask, that's the one to wear.
And Mary, what do you do about a beard? Like Bernie has a nice beard. What do you do about a beard with the mask?
It's fine. It's totally fine. As long as, I mean, you can get some to cover that up, but you don't even really need to, because if it goes to this, I mean, you're really trying to cut down the viral particle load that's being spread out. And that's going to still, you're not going to do that from the lower part. You're going to be doing that more from the direct. The N95s that I talked about is more for you, your protection against somebody else.
Okay. And what about guidance for workers and customers and really any social contact?
Well, first of all, remember your symptoms. Ask people about the symptoms: fever, cough, shortness of breath, fatigue, muscle aches, new loss of taste and smell, and chills. They need to be staying home. I can't tell people enough. They need to be staying home. If you're experiencing these symptoms, stay at home. If you have experienced them in the 14 days, stay at home. If you've been in close contact with anyone experiencing these symptoms in the last 14 days, guess where you need to be? You need to be at home, because those are the ones that they're going to want to quarantine people. Okay, so if everybody that on that last slide stays at home, I want you to consider now everybody left can still have the virus and can still be spreading the virus around, because you would be an asymptomatic person. And that's how you're going to protect your employees, your family, your customers, and that, assuming everyone there can give off the virus. Even if they pass the fever test, even if they pass the wellness test, because an asymptomatic person is one who's infected but does not show the symptoms yet. And we have at least 4 or 5 days that somebody can be doing that.
Yeah.
Okay. Next slide. Okay. So for your business or organization, your plan needs to focus on decreasing this risk of exposure, either through, I think we wrote that wrong, it should be airborne or direct contact. So you really are going to be looking at cleaning, keeping people from touching their face, from 6 foot distancing, keeping people 6 feet apart, keeping masks on people if they can, decreasing the time that they have interplay with each other, and trying to work with the airflow with them. You try to keep anybody infected out of your place, and that's going to be decreasing the amount of people that you're going to have spreading it. This includes everybody: employees, customers, everybody. Next. I know these sound really basic, but when you get down to your specific needs, you go back to that. That's what we do in medicine all the time. We go back to the basics. Okay, is this a situation where I'm going to have more contact? Is this a situation where I can have more airborne spread? So what do you do for your employees? Set the rules. Really decide what you want your establishment guidelines to be, and to be clear on those. Really make no exceptions, because this tells your employees that you really value them. These are the way it is. Get everybody on board and make it a habit. Just really keep it clear, keep it known to everybody. You really ask your contractors and employees, survey them. What are their knowledge? Have they been ill? Get all the information for them. Temperature checks. Yes, you need to do temperature checks. Does it cover everybody? No. So why do we do temperature checks? I just had a procedure at Swedish, and they did a temperature check. We know that I don't have to have a temperature and give off the virus. Temperature checks are there because if you have 100.4 temperature, you don't know it. It really isn't an obvious temperature. So it does pick up some people that are beginning to be symptomatic, and it is helpful. I think as the disease progresses, it goes over 100.4, but 100.4 is a good cutoff, and it's a good thing to keep thinking of. It's just a way to pull those early symptomatic people out. You still have to consider people asymptomatic, but it pulls out the early ones.
Mary,
Yeah.
on the temperature, Mary, I think it's also important for people to know that, in fact, our temperature has gone down. A lot of people still think that 98.6 is people's temperature. It's not, it's lower now. And I think that's important for people to know if they do decide to do temperature checks with their employees. Something I just thought I'd mention because that came up in another group I was with.
Yeah, it's also people's basal minimum temperature. It is pretty variable. One could be 97, one could be 98, one could be 99. Nobody's normal at 100.4. That's the key you have to tell people. If you have 100.4, I don't know if you have COVID-19, but I know something's going on and we need to sequester you. Wash hands frequently. It has to be available. Wash hands or get sanitizers, and we've got to use it, use it, use it. If you come home, don't use the sanitizer. Get to that bathroom as fast as you can. Wash hands. That's going to help with your decreasing the direct contact. And then something I strongly believe is empower your employees through education. Get them to really be knowledgeable at this. I was amazed at some of my daughter's friends who, still, they listen to things, but they weren't as up on it than I thought they would be, because I think being retired and older or in the business or thinking about this, you get knowledgeable. You're not at other ages. So make sure that they get this, that what the main things you're doing. You're decreasing the spread, you're decreasing it through airborne and direct contact. Next slide.
So excuse me.
Okay, this is one that we throw in because of me. I said, really think about your place. If you're a building, if you have people coming in, doing temperature checks, you're doing health questionnaires, do them outside the door. Don't bring them in to do that check, because you've just contaminated your whole building. If you find out somebody said, oh yeah, my husband is in his 10th day and he's finally getting better. No, they shouldn't be in your building. So try to do it either on the phone, online, before you go in the door, things like that. Have a place that your employees can come to the side to get their temperature checked, answer their questions, and that. Really try to, your space that you're going to be interacting with people as clean as possible, so you try to get anybody symptomatic or in contact with anybody symptomatic not in your space right then. Next. Okay, these are some, what do you do? These are really not fun things to talk about, because they're hard ones to talk about. What do you do about bathrooms? I'm going to tell you, I think the data is still out on a lot of this. We will get better data. They're doing studies right now, but we really need to talk about bathrooms. First of all, bathrooms are a high contact. I mean, you touch everything. It's highly touchable. So this has to be washed frequently. The next thing that's bad is the virus has been found in stool and feces. And when you flush stool and feces, it aerosolizes it. You all know it comes out. The data is kind of weak on that, whether it's a whole particle, a partial particle, how much is in it. Can it be in somebody's stool who's an asymptomatic person or not? We don't know. I would be on the safe side and say, if you have a lid, put it down if you're flushing the toilet, and also clean everything fairly frequently. My last 10 years were in the hospital, and I was director over a couple floors. We put waste baskets before you go in the bathroom and outside the bathroom. Why? Because the door handle is your #1 problem in the bathroom. So put a waste can in front of the door and some paper towels. Pick up a paper towel, open up the door handle, walk in, do what you need to do in the bathroom, throw that paper away, wash your hands real good, wipe them off with a paper towel again, use that same paper towel, open the door, get out of the bathroom, throw that paper towel on the other side of the trash can outside the door. You really want to protect leaving the bathroom door, that you're not recontaminating yourself. You just washed your hands, so use that paper towel, put it on the door handle, walk out the door, and then put it in the trash can on the outside of the waste can.
And Mary, I had a question. Is cold water okay if you need to wash your hands, if you don't have access to warm?
Yeah, in fact, there's no difference between warm and hot. It's the action of soap and water, the scrubbing that really gets it. The volume of the water is most important. I'm going to say, in addition to that, put waste cans all over your place. Wherever you put out tissues, put waste cans so people can use it and throw it away. You want to get that thing out of people's hands and don't have it sitting any other place. But if you can clean the door, people don't think of the door handle of the bathroom as the number one. Okay, so if you think bathrooms are a difficult situation, what do you think about children? We're going to have some special classes on daycare and camps and teaching art classes and ballet for children. And those are totally different subjects. This is about children that are in your restaurants or museums and things like that. This is hard. I'm going to tell you, you have to treat them like an adult. They need to be wearing a face mask because they can carry the illness. They need to not be touching things, and you need to watch them very closely. The next thing, dogs. Well, that information's not real good. And I'm telling you, when I know strong information from the data, I'll tell you when it's weak. I'm going to tell you too. Dogs are pretty weak. But they have found some virus in dog saliva. This is bad because my dogs refuse to wear a mask. So their saliva goes all over the place. And if you have a dog in your store, think about where that dog and what that dog is doing with its saliva. So right now, my advice is pretty much consider leaving the dogs at home. Okay, so how do you address your employee, or how do you help your employees and address the customers? Two types of customers or patrons. One is the type that don't want to follow the guidelines, and the other is who are uncomfortable with the lack of compliance of those customers who don't follow the guidelines. The best thing you can do for your employees and yourself, and I get this, you want to make sure your job is to make customers happy. To start off and really be comfortable with a statement that you can give, have it your own statement. For me, if they come in and they don't want to wear a face mask, my response probably would be something like, I wear a face mask for my family, for my friends, for my employees and my staff. And we've set our guidelines up, and our request is that you do also. If they come back and say, nope, I'm not wearing a face mask, I'm well, I don't need a face mask, always keep it me or I. Never say, you don't understand or you don't do that. Keep it me or I. I would say something like, I am sorry that at this point in time, I can't serve you at my establishment, you know, and just be very nice and just say, I can't, nothing against them, and try to lead them out your door. Get your employees to be comfortable with their statement, craft it so it flows easily. Remember your goal. Your goal is to keep everybody safe and decrease exposure to the virus. It's not a goal to try to change a person's mind. It's a goal to keep your place safe. And so you want to try to, unfortunately, try to get it out of there, get them out as soon as possible. I'm a pediatrician. I don't believe in rewarding bad behavior, but if you want to have something there, say Ruby Brink, you're at Ruby Brink, and they say, you know, I don't want to wear a face mask, and you say, I'm sorry, we can't serve you at this time. You can walk them out and give them a bowl of bone broth and just say, please take this bone broth. We're sorry, we can't serve you in any other capacity at this point in time. Or we can serve you as in other ways, like as a takeout or, you know, pickup or something like that. So that's something that really take the time, get comfortable with it, and that, because you want not to create a scene. And I'm talking to people who probably really know how to defuse situations and not create a scene. What do you do about the other customers? If somebody is upset about somebody not wearing a face mask, they're gone. You're not dealing with them, they're gone. If they see you respond to that, they're going to be coming back. So I think you take care of both of them by taking care of one. I think you're also telling your employees when you do that, I value you. You're important to me, and I want you to be safe. So now we get to the fun part. This is where it's your specific ideas and your specific needs, and we get to chat up about that. Think of your issues in 3 pods. One is employee to employee. This is important because your employees need to communicate to each other. They really do. Each one of you are going to have different ways that your employees, because you're in different situations. After reading all these guidelines, everything is pretty basic. Everything needs to be really uniquely tailored to your situation. You also want to deal with employee to customer and client, patron, how they're reacting. And by the way, don't shake hands. And then also how your customers interact, if you're at Bernie's stand, oh my God, I haven't seen Cheryl for ages, so I want to talk. Well, if I want to talk, I need to get out of his stand to have that talk. I don't need to be chatting up a storm. If you have a restaurant, you may want to say, 2.5 hours may be a pretty long lunch. Let's keep them closer to an hour. These are all your specific issues and needs and time to think about it. So Cheryl, we're up to, now they get to start writing things, right?
Right. And actually, I know for the sake of time, we put together a nice little sort of plan that kind of covers off on each one of these areas. And I think our goal with this workshop was to give you sort of the basics so that it could give you thoughts about your own individual situation. And so the form that we put together for you is an opportunity for you just to write down, how am I going to deal with employee things? Now, I know Bernie sent out a beautiful email explaining all the steps that he was going to take to keep people safe, which, by the way, Bernie, I applaud you. It was really good. And I was happy as a customer to see that. And, but what we were hoping is that for folks who listened this morning, maybe you thought of something that you hadn't actually included in your plan. Maybe it's about sort of signage for the bathroom. Maybe it's about sort of how many people you have in. Maybe it's about adding extra trash cans. Those types of things that we just talked about that you want to add to your plan. So what we did is we put the worksheet together for you to be able just to list out sort of what are the big things that you're doing and if there's anything new you want to add to that. And so we just thought we'd give you a couple minutes to think about that and kind of capture your thoughts after Mary just shared all of this information. And then we'd love to just in a minute, just open it up to hear what people kind of like what their ahas were and maybe what they're going to do differently for their business based on some of the things we've talked about.
I really think this is key. We can from each other, Your question may be somebody else's question they haven't thought of yet.
Yep. So, and Judith, I know you had a question you wanted to ask the whole group.
Well, I'm sorry, Cheryl, are you all going to put together signage that's from the chamber that says, please wear a mask, please do this, something very chamber community friendly? Or are you leaving it up to our own devices? Because I tend to be a bit direct and I don't want to piss off anybody.
So hey, you and I, we get each other. I'm direct too.
Oh yes.
But what we actually, this is just an example of the signs that we are doing. These will be all in 17 by 11. We have a whole series. It's not just these 3. We will also have others that we will be providing to everybody printed in color for you to put up. We also are doing floor stickers for people to be able to put out to mark the 6-foot distancing. If there are other things that people are interested in, we've got the one for the customer and clients that says, please wear a mask and practice social distancing. Then that matches with the 6-foot floor stickers. For employees, wash your hands often and stay home if you feel sick. Really basic, right in your face. Signage to say, please stay 6 feet apart. And then we also have a commitment we also have a commitment to community safety for Vashon slide as well that we're going to be, a poster we're going to be doing for every event. You can see from the, so hopefully that answers your question. So yes, we will have signage for you and that actually will be in your kit printed so you don't have to. And then you can put them up and you'll notice that they all have a logo on the bottom for the chamber as well as for Vashon Be Prepared. So our goal here is so that everybody has consistent signage so that if people are coming to your establishment, it shows them that actually we as a community are all working together with the same rules, with the same ideas, so that in fact, hopefully people get the point. And you know, we have a lot of people who this past weekend came from off island, and I think it's really important to communicate that this is how we want to roll on Vashon to keep our incidence low. We're very, you know, lucky, I think, that we have a low incidence, at least that we know of right now. So hopefully that answers the question, Judith.
Well, excuse me. Yeah, it does. So in the case of a small studio like mine where I need to schedule appointments, am I keeping a written log, or do I need to have the client that's visiting me complete a form?
I think that you can keep a written log, is my understanding.
Okay.
They're suggesting that you keep the log, but have everybody know that if they come down with the virus, they should be calling you. And always tell people when they're writing in that log, this is so I can reach you in case somebody has come up positive. The log just needs to say their name, some way to contact them, email or phone. And also, what was the time that they were there? You really need to keep an eye on, you know, because you want to know that they cross paths.
And also make sure you have a clean pen and a dirty pen. I was at the country store, and I have to applaud Jan for having, you know, she had her clean pens for people to sign the receipt, and then she had her dirty pens. So you take a clean pen to sign, and then you put it into the dirty bucket afterwards. If you're going to be using that type, if you're going to need to use pens for anything or any kind of authorization. Other questions that people have, other thoughts that people have, other needs.
I've got one, and I think this might apply to Elsa also. We're essentially museums. When you walk into the house, you can circulate, but most of our interpretive signage, if we were to have it 6 feet apart, we'd have to take down 3/4 of our exhibit. When social distancing isn't possible, is a mask enough?
Well, I can answer that. That's really where the mask comes in, is when social distancing is possible. But also think about the other two, the time and the airflow. If you've got people in a line, they're not in a line reading, they're not face to face. So you're decreasing the airflow there. So think about it. You want 6 feet apart if I'm looking at you face to face. If we're shoulder to shoulder, that's a different story because we're putting out in a different airflow. Does that help?
Yeah.
Also, you can jigger it around. You can stagger it. In this instance, I would tell you not to stagger it if they're reading things next to each other, because you want to be more in one line so that you're all looking forward.
Yeah, and I think you could imagine, Mary, what I'm talking about in terms, we've got stuff in a very narrow hallway that's just right next to each other.
And we can walk the site too, but this is what you need to do. Everybody needs to walk the site, see where your issues are. And then you really need to possibly limit the amount of people. You want one way in and one way out. You do not want people going backwards. If I'm over at Bernie's stand and I see he's got some great asparagus, yay, he's got asparagus. So I decide on the asparagus, and now I want to go back and pick up the onion to cook with it. Nope, I can't. I shouldn't really go backwards. I should keep going forward. And maybe I could ask one of his assistants to pull an onion for me. Keep the flow going one direction, one way in and one way out.
With hand washing stations.
Yep.
Not hand washing, but sanitizer. And by the way, sanitizer will be in your kits, which is something just nice. And we're also going to do sanitizer refills for people who already have sanitizer bottles, as a side note. other questions or other concerns people have. I know for us, we have production issues. So my husband has to be able to bottle and label with people. And so he was having to figure out how people could stand next to each other to make sure that we were bottling and labeling safely with masks on. So, you know, it's interesting. Every business is different and every business has a little bit of different challenges and issues. So we, you know, we put the worksheet together so that you could just jot down what it was that you were thinking and what you're going to do, because this actually then helps you communicate to your employees. It also helps you think about how you're going to communicate to your customer or clients. And then also how you're going to arrange your workspace, just like Kay was talking about. What do you do? Do you limit time? Do you have it one way walk through? Do you take down display or two? I know a lot of the merchants that we've talked to, and Kathy mentioned this at the beginning, are going to rearrange their stores so that there's less stuff in the middle and people can move around a little bit more effectively.
So I have a question, Cheryl, regarding the thermometers or the temperature takers. Is that part of our kit, or is there a source for that?
We are in the process, and I have to apologize. We are not completely all done with all the kits because we're moving so fast. We're really trying to get everything done as quickly as possible, hence the reason Sarah is working with us. But we are going to try to find a good source for discounted thermometers. And Mary, I don't know if you have a recommendation on a good thermometer.
Touchless, you know, that's the key, touchless thermometers. I know when we passed the restaurant supply store in, is it Soto where it's located? I'm not real good about Seattle, but in that kind of area near the stadium area, they had a sign saying they had touchless thermometers. And that's what you want. That's what the hospitals are using too.
Okay, great.
And I'm sorry, I have one last question for Bernie. Bernie, can we order online ahead of time? I mean, we all know that you are the official start of summer, and it is, you know, a ritual that we all look forward to. But I trust your cherries. I know where they've been. I want to order them.
You talking to me?
Yeah.
Yes, we're talking to you. We want our fruit.
So I've had that question a few times. I just don't have the labor to do that. So it's walk in, you touch it, you buy it, walk out, pay, and then walk out. I really don't have the labor for a grab and go, or I hand it to your car, things like that. I mean, I've done that for the food bank and for senior center, very labor intensive. So sorry, Judith, you got to see my face
Ah,
and
wow.
walk out.
I do have another question from Michael, Mary, for you. Can you just talk a little bit more about the log of customers in and out?
It's not mandatory. The governor got pulled back on that, and but it's a good thing to have. I'm going to tell you, if you presented it to your customers, I think they would understand. A log is to tell you when a person was there. So if I had a client come in, you want their name, you want their date, and the time, 9 to 11, and that they were at this premises. And then and you also ask them, if you turn out to have the virus, please give us a call, because then you can look back at your log when they were there and see who else was during the same time frame. And that's going to be key. You know, we talk about direct contact is important, but really the overwhelming majority of people are getting infected by airborne. So you really want to know who was in that vicinity at that point in time that could have gotten an airborne illness. It's going to help you. It's going to having a log tells your employees, I value you. I want to know if you were here when someone was sick. You also want to have it so how you would tell people is, listen, I want a log because if somebody comes sick, I want to be able to know if you were here at that time, to give them a call to tell them you were in the vicinity when someone else was here. And it's a way of, I think it's a way of treating your customers and your employees like you want to be treated. I want to know if I've been in contact with somebody.
One other thing I just want to add, there's been several articles in the Wall Street Journal and other news outlets that are talking about how customers want to see you being clean. They want to see you cleaning and taking the steps to keep them safe. And it's actually, they were talking about Disney World reopening and all the steps they're taking, but it's really important for people to see that you're taking it seriously. And in the articles, it talked about having the hand sanitizer front and center for people to see, the Clorox wipes, if you can get them, front and center for people to see your staff cleaning and taking it seriously, having the sneeze shield there, or having people with masks on. There is, I just think it's important that, as business owners, that we're thinking about this and taking it seriously, or as nonprofits and museum folks, because this is something that a large part of the public is really interested in and is looking for and is being reassured by. They want to see that you're taking it seriously, so that then they're comfortable being there. Another question for you, Mary. Can I use the credit debit system and date stamp on the checks as an actual log? Otherwise, you've got about 200 people using a pen.
Yeah, you're right. I don't see why you couldn't. If it has the time, you really need the time they were there and the time they came out. And this pen thing has been a big ordeal. I basically, when people would come in, I would give them a pen and that's their pen, get a whole slew of Bics or pencils or that. They can fill it out in a pencil and really let them have their own pencil to use throughout the way, because you're going to get that pencil going back and forth. And about using the credit debit system, date is good. You just need to know the time. And I have to answer, Bernie, I don't know the credit system, whether it gives you the timestamp or not. How dirty is cash? They're also telling you not to use cash. If you can use credit card, it's much better. We don't know how long it's been, how long it'll last on paper, but it may be up to a day on dollars or on any type of mail or paper. So we don't know. I think that's going to get cleaned up. Bernie, when I get more information on that, I'll let you know. They are suggesting everybody not to use cash if at all possible.
Okay. Guys, we've got about 5 minutes left on the time we had scheduled. Is there any other urgent burning question before I do a quick overview of what's in your kit and how you're going to get them? All right, got another question that popped up here. Oh, you guys are so sweet. Thank you, Judith. We try. We're not perfect. We knew this one was going to be a little rough, but we are trying to make sure that we're providing as much information as we can to keep our community safe. And I think the conversations are what is most important. And I also would say the other thing that's really important is that you have a plan and you know what that plan is, and that actually your customers and your employees understand what that plan is. So that's why we put the worksheet together for you. As it relates to the kit, what we're doing is masks. We actually have masks, and the worksheet that Sarah sent out to you, or the order, kind of not order form, but like sort of what do you want in your kit questionnaire that Sarah sent out. You can let us know whether you want masks. We've got hand sanitizer that's coming in. Those will be 8-ounce hand sanitizers with the pump. We'll have signage already printed for you. We'll also have the social distance floor markers. We're also, for people who have online businesses, we're going to actually have a community commitment to safety seal that people can put on their websites, just to let people know that the steps you're taking. So maybe you're like Bernie and you have a whole list of things that you're doing. You want to tell your customers about that online or on signage. And then you can have this say, hey, you know what, I'm a part of what's going on with Vashon and we're all in this together. And that's part of the Vashon Community Commitment to Safety placard that we're doing. A couple one-off opportunities that we're working on is the sneeze shield that you saw in one of the pictures. We've had a couple requests for that. We're trying to source that for local people so that it's easier for people to get it. And that, I'm sorry, that's the face shield. sneeze shield, we actually have a local company that is helping us build those. If you need a sneeze shield, please let us know. We have a local source that will build that and help you install it. And then we're looking for discounted thermometers. And of course, after the talk, of course, one of the things one of the things that we also just heard on this is maybe adding pens and also adding tissues, just to help out if you don't already have those. Certainly put that in the other column or let Sarah know, because our goal is to come up with, kits for everybody so that, one, you can reduce your cost. Two, we have a consistent message across all of Vashon businesses and nonprofits. And then, of course, we're keeping our employees safe and we're keeping our customers safe, because then they go to the next business and the next business, right? So that's the idea behind the reopening kits. So how do you get them? I already showed you the signage. We'll have more of signage than just this, but I wanted to put an example in. So how do you get this? Submit your form saying what you're interested in getting, and also let us know what your plan is and send it in to Sarah, and Sarah will help pull together those kits. We're going to be using our Nashi North location for pickup. It's really convenient for people. You guys know I own Nashi Orchards. 107th and Cove, which is pretty close to Mukai. We aren't operating any of the tasting room out of there, so we figured it would be a great central location for people to come and get their kits when they are ready. And Sarah will be notifying you of the date and time that they're going to be ready. We're thinking that we're going to have most of the components by this weekend. We might be a little delayed on one or two components, but we can still get those to you guys after the fact. So that is our workshop. And I just want to thank everybody for joining us this morning. I hope that you found it helpful. And one last question came up about the public trash cans. The public trash cans are really an issue, Kathy, and I'll tell you why. Because right now, no one really owns those public trash cans. And so getting trash picked up, poor Jim Marsh, who used to be our executive director for the chamber, used to go out and pick up the trash himself, and that wasn't actually part of his job description. He just did it because he wanted downtown to look good. And so the trash downtown is actually an issue, and we have to find a solution for that. So maybe we can band all the merchants together to get that taken care of. But I hear you loud and clear. So with that, I just want to thank everybody. If you have other questions, oh, good. I'm so glad this was helpful. If you have other questions that you think of, after you've done the workshop and you're like, gosh, I should have asked Mary that, go ahead and email me at boardpresident@vashonchamber.com, and somebody will get back to you. And any questions you have would be great for us too, so that we can include that information in other workshops that we're doing. And I just want to say, hope everybody stays healthy and safe. It's nice to see everyone's face, and it's more important that it's great to see everybody come together as a community. So with that, I'd like to say thanks, and Sarah will be in touch. See Sarah on the picture there? She's the one who's going to be contacting you to put together all the kits. So we will.
I'd like to say thanks too, because really y'all make Vashon what it is and why I love to live here. This is just a great place, and thank you for allowing us to do this.
Yeah. And Mary, you're a rock star. Thank you so much for doing all the work to get this all going. I just, I know I owe you ground cherries. Just so you know, guys, I grow ground cherries, and that's the deal I have with Mary for this. So anyway, I will we'll talk to everybody later. Have a great day. Mary, thank you. Everybody, it's so nice to see your face. I can't wait for the fruit. Come on.
Yes.
All right, guys. Have a good one.
Bye-bye.